Hi all, I'm Dr. Karthikeyan, microsurgical andrologist and neurologist at Apollo Hospitals, Grimsworth, Chennai. In this video, I'm going to take you through about azoospermia. What is azoospermia? Azoospermia is a condition which is now becoming very common in the OPD, partly because we are a tertiary referral care center where we keep seeing many patients of azoospermia, but as well, the azoospermia is on the rise. Many people are nowadays getting diagnosed with azoospermia. The incidence is as such increasing, and we're able to see more and more genetic problems. So before we even go into what are the causes and what is the treatment, first understand what is azoospermia. Azoospermia is the complete absence of sperms in the semen. That is, there is not even a single sperm visualized in the semen sample which is given by the patient. There are two main causes for azoospermia. One is a reduced production inside the testis, and number two is a block in the testis passage, which is more problematic. As you can understand, a blocked passage implies that there may be normal sperm production inside the testis. However, the most of the patients, that is up to 85% of men who come with azoospermia, belong to the type where there is a production defect. This production defect, the type where the sperm production is less, this is called non-obstructive azoospermia. That is, there is no obstruction to the sperm passage. And obstructive azoospermia is a condition where there is a block in the sperm passage, or rarely there is no sperm passage. So again, coming back to the definition of azoospermia, which says that there is no sperm in the semen, there are some important things we need to tell a patient before telling him as azoospermia. Number one, are multiple samples done for the patient? Have you given multiple semen samples, preferably at different labs? Have you seen it at different times of the week, different times of the year, before we can conclude that yes, all the semen samples do not contain sperm? Number two, it's very important to do these tests in reliable place. Reliable place means a fertility center, because they see the sperms day in and day out. Number three, are you able to give a correct semen sample? By what is the meaning of a correct semen sample is, are you able to give a masturbatory sample in a container to the full volume? And are you able to consistently give a good volume? Do you have any difficulty in collecting a sample? Were you able to collect the sample in the hospital? So these are the main things we see, because based on each thing, there can be a problem, there can be an error in the report, and this can lead to a wrong labeling of the patient as azoospermia. Why do you think that even if it is wrongly labeled, so what? This is because azoospermia is a specific condition where there is no sperm in the semen. It is usually genetic unless proved otherwise. It can be due to hormonal issues. Whenever a man comes to a diagnosis of azoospermia, he is dejected, he is heartbroken. He thinks that my life is ended, I cannot father a child. So he goes into a sort of a depressed state where he thinks that nothing will move on in his case in the world. So next time. So when we make a diagnosis of azoospermia, or when we give the patient the news that you have azoospermia, we should be doubly sure or triply sure that there is, yes, this patient has azoospermia and this diagnosis is probably right. This is the most important information or most important point we stress in our OPDs. And before we are sure that this patient has azoospermia, even though he walks into the OPD with multiple reports saying azoospermia, we don't label the patient as azoospermia. This is mainly to keep the mind confident. When you are confident, you will give a better semen sample, and our lab may be able to pick up the rat sperm in the semen. If you have been diagnosed as azoospermia correctly after all the tests, then what? Then again, we go into the cause. What is causing this azoospermia? What is the reason for this azoospermia? So as I told, it can be a production problem or it can be a block. This production problem is called a non-obstructive azoospermia. And this obstructive problem, that is a block in the passage, is called a obstructive azoospermia. In the non-obstructive azoospermia, we may have two or three main reasons. One, as I have been telling from the first, it is a genetic cause. It can be a varicocele, or it can be a hormonal problem. In obstructive type, it may be two or three reasons again. Number one, it can be a block in the semen passage. It can be in the testis site, or it can be in the place where the semen comes into the semen, that is in the urethral level. Or it can be a rare condition called CBAVD, where the vas is absent from birth. That is, the vas is the tube which causes sperm transport from the testis to the semen. If this is not developed from birth, then obviously you cannot have sperms in the semen. So this is a very specific genetic condition. It's a serious genetic condition, but luckily for this particular patient who comes with CBAVD, there is no other problem in his body of the major condition called cystic fibrosis. but he has only a problem in the tube where the tube has not developed. That's a reasonably small issue. Even though azoospermia is a big problem, the part that is the absence of the sperm tube is a very small part of the major condition called cystic fibrosis. We'll come to it later in some other time. But what here we are going to understand is what is the major difference between a non-obstructive type and an obstructive type. In non-obstructive type, as I have been repeatedly telling, this is a problem in the production. What does that mean? The sperm production is defective. Why is it defective? It may be because of a hormonal issue, a varicocele, or a genetic problem. So genetic problems are usually not correctable, while a varicocele is surgically correctable and a hormonal problem is medically correctable. So again, we have to see if these correctable causes are there, then it is making our life simpler. We can give a medicine, we can do a surgery, we can expect an improvement. In the obstructive type, if it is the third cause, which I told CBAVD, then there is no cure. But again, you should be lucky that the sperms inside the testis will be of good quality. And the other two things, where there is a passage problem either in the urethral side or in the testicular side, these may be amenable to surgical correction. The second thing what we see is what is the testicular size? Is it big, normal sized, or it is small, or it is a testicular problem where the testis is soft and flabby? If the testis size is good, then again it means that we will get sperms and the sperm's quality will be good in most patients. The third thing what we see is the follicle stimulating hormone, that is the FSH. So what we see in a patient when they come into the OPD with azoospermia is what probable type it is, what is the testicular size, and what is the FSH, and what cause could probably be leading to this azoospermia. All our testing, all our evaluation is based on these three things. And whenever you go through your reports or whenever you make some conclusions in your mind, always remember to see these three things and base your decisions on that. So again, in this video, to summarize, what I told is azoospermia is the complete absence of sperms in the semen. It's a specific condition with a specific cause. All the thing the andrologist does is to identify the cause and then give the treatment. The main things we see are whether the semen volume is good. That is, whether the patient is able to give an adequate semen sample, or the sample collected properly and reliably assessed. Is the testicular volume and the FSH okay? And finally, is it a non-obstructive type or an non-obstructive type or an obstructive type? So these are the main factors which we see during the evaluation of azoospermia. The treatment of azoospermia is different for different patient groups, and we will see it in some other situation. If you like this video, please share it and subscribe to our channel. Thank you.